All right. I'm just gonna play let a little bit of this play before I bring up my issues with Joe Biden's healthcare plan.
Vice President Biden, yes, this is for you. Your health care plan calls for building on Obamacare. So my question is, what is your plan if the law is ruled unconstitutional by the Supreme Court? You have 2 minutes uninterrupted.
What I'm going to do is pass Obamacare with a public option. It'll become Biden care. The public option is an option that says that if you, in fact, do not have the wherewithal if you qualify for Medicaid and you do not have the wherewithal in your state to get Medicaid, you automatically are enrolled, providing competition for insurance companies. That's what's going to happen. Secondly, we're going to make sure we reduce the premiums and reduce drug prices by making sure that there's competition that doesn't exist now by allowing the Medicare to negotiate drug prices with the insurance companies. Thirdly, the idea that I want to eliminate private insurance, the reason why I had such a fight with 20 candidates for the nomination was I support private insurance. That's why not one single person with private insurance would lose their insurance under my plan, nor did they under Obamacare. They did not lose their insurance unless they chose they wanted to go to something else. Lastly, we're going to make sure we're in a situation that we actually protect pre-existing. There's no way he can protect pre-existing conditions. None, zero. You can't do it in the ether. He's been talking about this for a long time. He's never come up with a plan. I guess we're going to get the pre-existing condition plan the same time we get the infrastructure plan that we've been waiting since 17, 18, 19, and 20. I still have a few more minutes. I know you're getting anxious. The fact is that he's already cost the American people, because of his terrible handling of the COVID virus and the economic spillover, 10 million people have lost their private insurance. And he wants to take away 22 million more people who have it under Obamacare, and over 110 million people with pre-existing conditions. And all the people from COVID are going to have pre-existing conditions. What are they going to do?
I have a follow-up for you, Vice President Biden. It relates to something that President Trump said. He's accusing you of wanting socialized medicine. What do you say to people who have concerns that your health care plan, which includes a government insurance option, takes the country one step closer to a health care system run entirely by the government? What's your response to them? I
say it's ridiculous. It's like saying that, the idea that the fact that there's a public option that people can choose, that makes it a socialist plan. Look, the difference between the president, I think health care is not a privilege, it's a right. Everyone should have the right to have affordable health care.
That's enough. So, of course, if you believe that healthcare should be a right, then you should support universal healthcare. But whatever, he's kind of stuck to being the corporate Democrat, so he can't really go further than where he goes. But my issue is, he's lying. Now, Biden's plan is not a bad plan. It's not a bad plan. Like, anything to improve healthcare for people in this country is good. Like, regardless, like bar none. Like as much as I would love the Medicare for all or some sort of universal healthcare option, anything that makes it better is just fine. Let's just take what we can get while fighting for Medicare for all and universal healthcare. Let's get the screen. So, the reason why I have an issue with what Biden is saying is that it's because he's lying. And what he's lying about is he's calling his plan a healthcare public option policy. It's not public option. Now, when you go deeper into his plan, his policy proposals, and what he's actually advocating for, it is just an expansion of Medicaid, which is not a bad thing. So the idea of a public option is that there is competition for private health insurance for the vast majority of people in that country. So essentially, you can either choose to go with your private health care plan or choose to go with the public option. That's it. That's how public option works. Biden's plan only expands Medicaid. If you are underpaid, or if you are unemployed and requesting unemployment benefits, you are forced onto Biden's healthcare plan. That is not a public option. That is essentially a replacement of COBRA and an expansion of Medicaid to kind of cover up for the failings of the private healthcare system. It doesn't compete with it. It competes with COBRA and COBRA plans, but cool. But that's not the same as competing with healthcare insurers on a whole. It's not an option between a public option and a private option. It's not. And so when people buy into Biden's statement that he has a public option, it frustrates me because it's like, no, it's not a public option. It's literally just an expansion of Medicaid, which is not a bad thing. Like I said, it's not a bad thing. It's great that he wants to expand Medicaid. It's great that he's going to help people who need it, like the people who are underemployed and the people who are unemployed, especially now during the time of COVID, where so many people, like they said, 10 million people lost their jobs, and even like 150,000 more just lost jobs in December last month. So I get frustrated though, because people are just accepting Biden on his word. It's like, oh, Biden has a healthcare option, a public option plan. No, he doesn't. No, he doesn't. He does not have a public option plan. Don't let him set that narrative. That he is having a decent plan, a good step up from Obamacare, from the Patient Protection Affordable Care Act, but it's not a public option. And they say, oh, well, 97% of Americans can be eligible for Biden's plan. Well, that's pretty much the exact same eligibility that exists for Medicaid. That technically, theoretically, 97% of Americans can theoretically get on Medicaid. They aren't ineligible to breaking some federal laws or having a certain size family or, just being ineligible due to various other reasons. I think like living outside the country for a certain amount of time makes you ineligible for a while. So that's why there's the 3% exists. It's because theoretically, but of course, this Medicaid could not support 97% of people on its plan. So of course, it's not actually 97% of people. It's always just a rotating number of people who are unemployed or are underemployed. It's not actually like 97% of people can just jump on the plan. And so he lies. Now, that's what politicians do. And like I said, like Biden was a better choice than Trump, and his plan is a much better plan than Trump. Getting rid of pre-existing conditions with no backup plan. Just go back to healthcare pre-2009. Are you kidding me? But I for the good things that Biden's plans does, I do need people to kind of understand and realize that it's not a public option, and to not allow him to frame it as public option. Because when we come back and when we realize what it is later on, when he pushes, when the bill gets written and people start reporting what the bill does, and we realize it's not even a public option, it's not close, then we're gonna realize that tough shit. It's too late. That's the plan that we're gonna have to fight for. And I'd rather be the socialists of old, people who fought for socialism, but got us the 5-day work week, got us the 40-hour work week, got us paid vacations. Fight for the end goal and get something better. Get something better than that currently exists. Compromise on a higher, the higher way of living. And so when he goes in there with this law, in this bill that's just expanding Medicaid, and remembering that Medicaid was already expanded under the Patient Protection Affordable Care Act, and states rejected that funding. Texas, where I live, Texas, was the only Republican state that had a surplus with the U.S. with the federal government in terms of debt. Every other Republican state was in debt to the federal government, borrowed more money than was taken. And then Texas refused to take the free Medicaid money for the expansion. Expansion still happened. They just refused to take the money. And now we're taking the money from other things, and we have a debt with the federal government. Congratulations, Texas. What a principled stand. But yeah, I think it's very important to know that Biden's policy that he's suggesting is not public option, and what he's going to put out there is going to be very disappointing based on what people are already thinking of. Because people are thinking he's going to put out a public option. He's not going to put up a public option. He's not going to put up a single payer. It's not going to be anything like that. It is literally just expansion of Medicaid, which again is a good thing, but should be the bare minimum, not what he's fighting for. He should be fighting for Medicare for all. He should be fighting for universal health care, and then getting single payer, public option, something like that, and not just starting at this very milquetoast, standard, boring Medicaid for all that's means tested and has, a lot of issues. A lot of the same issues that Patient Protection and Affordable Care Act had.